Dr. Ennis, let's talk a little bit about tests. There are some people out there, be it the insurance people, even here and there, the governments, be it the Congress or whatever, who try to be, saving money left and right. And they keep accusing doctors of doing too many tests. Shed some light on that stuff, because at the same token, most of us patients, we're not exactly waking up, hallelujah, today I can do another medical test. That's not exactly what we wake up to for either. So it's easy for us to kind of like look the doctor in the eye and look at him like as a used car salesman. You just want to sell me something else here. Shed some light on it. Give us the lowdown.
Yeah, certainly the technology that medicine has today is far superior to what it had 30 years ago. And those tests are expensive. We can do and diagnose a lot today without doing surgery that we could not do 30 years ago. All those things are expensive. It's always a judgment call as to, well, how many tests should I use to come to a diagnosis? I can tell you what we try to do is we're sensitive to the patient's money, and we try to spend the smallest amount of money to get to the bottom of the diagnosis that we can. But getting a diagnosis is a process. It's not a one-time thing. It's not a one visit. Certainly we have an initial impression based on what the patient has told us and based on our examination. And after that impression, we order diagnostic tests that confirm that, or to investigate the things that we're concerned about. That can be blood work. That can be evaluations of your urine. It can be certainly plain film x-rays. It can be MRIs. It can be other studies. All those things are important in getting to the diagnosis. Certainly we, as well as most physicians, I think, try to spend at the smallest amount of money that we can. But at a point in time when we don't have a diagnosis, and when we're trying to pursue a problem, the problem doesn't go away, we need to use those other studies. The insurance companies certainly don't like that. There's no question about that. I cannot tell you the number of times that I've had discourse with insurance agents that don't want to get something done. I even had a patient with a heart attack in our facility, and the insurance agent was not going to allow me to hospitalize the case. They wanted me to send him home so that he could be seen by his primary care physician the following Monday. Even the patient was persuaded by that. And what I did in that case was I told the patient we were admitting to the hospital. I called the mobile intensive care unit and had him transferred to the hospital. Later on, he came back and thanked me. But it's difficult at times right now to do the right thing because the insurance companies are very controlling in terms of what they will let us do. And I'm being kind to the insurance companies. So getting a diagnosis is a process. A doctor, we make an evaluation. We order some diagnostic studies. We evaluate those studies and see, do we need anything else, or do we have enough information to develop a plan of therapy? If we have enough information and we develop a plan of therapy and the patient does well, then we do no more. Or if we don't have enough information to have a plan of therapy, or if the patient does not do well, then we look harder. And usually that means more diagnostic testing. Right. Have I answered your question?
Well, I definitely think you did. You said that, medicine has advanced drastically, and I almost wanted to ask you kind of like, prove it. I know we have more high tech, but prove it. But then as you kind of kept talking, I also kept realizing that life expectancy obviously has risen by 20 some years, I guess, over the last, not too long really, right? People today, 80s and 90s is not, where I have in an Italian restaurant I go to on a daily basis in the morning and have a little coffee and a sandwich, I'm met there by about 4 or 5, 80, 85 years old almost all the time. And then they are active. They go to church. They do, they're active. They drive. This type of thing hasn't happened 30, 40, 50 years ago. And so obviously and the tests must be a part of that, kind of like find out what it is. I've always felt that doctors are definitely good in diagnosing a thing very, very, very well. So I guess I answered my own question, and that must have something to do with 40 years ago when I still went to the doctor when I was a kid. The guy, he took something or nothing, and it's just like, oh yeah, this one, he took one hand, and on the other one, and he poked. And that looked rather advanced to me. I mean, really, of course. I don't think you do that anymore today.
I would say certainly we do that. Do we evaluate a patient? We put our hands on a patient. But there are many more things that can be done to evaluate a patient's health than just the physical examination. The physical examination is still the most important because there's no way that we can order every test on every patient. It would just be way too expensive and too intrusive to the patient.
Right.
And so the examination is important. And then after the history, after the examination, then the diagnostic testing is far superior to what it was many years ago.
Right. And even though you're very specialized in dealing with people who have a acute current injury and an emergency, basically, you do that job, and people obviously are coming to you for that because you do have many normal patients where you are their primary care physician for, right?
That's correct. That's very correct.
Yeah.
So certainly is an honor and privilege, and we enjoy that very much.
Right. And I'm the type of guy who is not exactly going a lot to the doctors. In fact, since I'm 18 and I'm now 58, I've gone once for a 2-day physical examination, and my wife pretty much the same. And I got a clean bill of health, and boy, did it feel good. Do you understand? It's kind of like, so yes, an examination, even though I didn't feel sick but after that I felt just so much better, because the guy said, well, whatever you're doing, Helmut, I don't really care because it's fine, keep doing it. and it's great to find out, eliminate, it's like with a car, you walk in there and say, no, your car is fine, it's all fine, you die, everything is fine, you feel good, you feel more safe, more secure, and boy, that must be the case with your own body. Do people go enough to do those, whatever, yearly, bi-yearly, whatever, depends on the age, examinations, or are people lacking on it and are not quite doing it the way they should?
I would say most are lacking and do not do it the way they should. The most important thing in terms of your bodily health is to go to the doctor when you have symptoms. That's number one. If you go to the doctor early when you have symptoms, you have a better chance of establishing an early diagnosis. Certainly, annual examinations are important, and I would encourage you to do that. Encourage you to, we do those all the time. But certainly, if you're having symptoms, if you're having blood in your urine, if you're having blood in your stool, if you're having a pain that doesn't go away, if you're tired and that symptom is not being alleviated by extra sleep, you ought to be seen, and you ought to come in and let us take a look.
Right, because something very systematic could be wrong, which yet at that time, in many cases, still can be fixed.
Mm-hmm.
Well, all right. Again, thank you very much for your information, Dr. Ennis.
Thank you.